Hi, I'm Dr. Hajira Nazeer and I am a dental surgeon and a cosmetic dentist. I have 8 years of experience in this field and I'm the founder and director of Richmond Dental, which is located in Langford Road. So diabetes, let's talk about diabetes and the oral health. There is a strong sugar connection we can see that causes a lot of oral health issues. During diabetes, there is a research which is shown that diabetes, if not controlled, can lead to several gum problems like gingivitis, periodontitis, chelitis, mucositis, aphthous ulcers, which can lead to again several severe problems. How can we avoid this? One is we can go for a regular checkup and we can make sure that we have a proper check on our sugars. During the diabetes, what happens is the sugar levels will affect the gum conditions, which will lead to bacterial infections, which leads to periodontal problem. The periodontal problem in turn causes the bone loss, and whenever there is a bone loss, then it leads to the loss of teeth because of the lack of support and the periodontal ligament, which can detach. Hence, a round of scaling every 6 months can avoid this kind of a situation. A regular brushing, flossing and mouthwash is very important. Whenever a patient, especially a diabetic patient, goes for an extraction, you can see that the dentist always asks for a consent from the physician. This is basically to avoid the problem of delayed healing or a dry socket. These are the complications which can cause pain and a lot of discomfort for the patient. Diabetes is a very common problem because of the lifestyle, and if you can see that the Indian population, after China and America, we stand third in the world population for having diabetes. Now we can avoid a lot of things as we know that we are diabetic. So for instance, if we are smoking, we can quit smoking. Smoking again leads to severe consequences along with diabetes. It can lead to the deprivation of oxygen level in the gums, which leads to periodontal diseases. So we have a few tips which we can utilize to avoid going through such a scenario. First thing is, of course, brushing, which is very important. Brushing not only the teeth surfaces but even the gum line to avoid the deposits which are stuck onto the gum surfaces. Then we can brush our tongue to avoid conditions like oral candidiasis or several other diseases. Then we need to floss twice daily. Flossing is basically, removing the food or the debris which is stuck in between the teeth, especially the inaccessible area which the brush cannot reach. And we can use an antiseptic mouthwash. The most common antiseptic mouthwash which we find is clorhexidine, which is very, very important to maintain our oral hygiene. Schedule a dental checkup with your dentist every 6 months, and please let the dentist know that you have diabetes so that they can take further precautions. Thank you.